I'm here with Dr. Diego Allende, who is a Ringside Doctor. Thank you so much.
Thanks for having me.
Well, now have you done martial arts yourself?
I did, yes.
In what style?
Taekwondo.
Really?
Yeah.
Where at?
I did it at West Coast, I guess, Taekwondo studios back in the 1980s.
Okay.
So that's what I trained under, and then it was under the Professor Kim Association in South Korea. So it was so long ago that I did formal training. But that was where I started, and that's where I kind of did a lot of my martial arts.
Was that here in Fresno, or?
No, that was in the Bay Area, in
Oh.
the East Bay, San Francisco area, a city called San Ramon.
Oh, yeah.
Yeah.
All right. How long did you study? A few years? Did you get the black belt?
I did. I earned a black belt, so I did several years. It was like between the ages of 14 and like 17. Worked really hard at it, every day of the week, multiple class sessions a day, and then competed on the weekends in both form and competition sparring. So I was able to get my black belt at a pretty relatively quick time compared to a lot of other places.
Okay. Yeah, I started taking martial arts. I'd always been interested in it. In fact, the TV series Kung Fu, I just had to watch it every week. But I didn't get started till I was in my late 20s, and someone had threatened me. And so I decided, well, I'm going to take a few months of this and just learn some self-defense techniques. And I got hooked. And then I got into tournaments. And weapons were kind of my thing. But yeah, I have quite a few friends who are into Taekwondo. Have you seen the movie Best of the Best?
Long time ago.
Okay.
Yes.
I've actually interviewed 4 of the actors from that movie. Eric Roberts, James Liu, Simon Rhee, and Philip Rhee, his brother. Philip Rhee plays the character Tommy Lee from Fresno, California. So when I met Philip, I said, "You're my favorite character in the movie because you're from Fresno, California." Okay, now, what drove you to start taking martial arts? Was it just something you saw, thought that looks interesting, or a friend talked you into it, or your parents said, "Let's enroll him"?
Well, I always thought it was kind of interesting. I always liked the martial arts movies. Thought it was very fun to watch, entertaining. And I have a twin brother who lives in the Bay
Really?
Area. And he actually went and started taking some classes just because he decided he wanted to. I don't really remember exactly the reason why. Of course, we were like very young back then. And a few weeks after he started doing it and he was practicing some of his techniques, I kind of got interested in it. So I said, I want to go too. And so that we all started going together. And then my older brother enrolled also. And then we all started taking the classes. And it was really just one of these things that we were very interested in, just watching the old Bruce Lee martial arts movies, some of the greatest stuff on, in those days. And that was part of a motivating factor. And then because my brother did it, I felt like I want to do it too.
That's great.
Yeah.
So now how do you become a Ringside Doctor?
Well, there are some pre-qualifications. You have to be trained, have to be at least 3 years out of a residency training. So you need to be in a specialty practice and working for some time board certified in a specialty of your choice, as long as you can be trained into giving physical exams and clearing athletes both before, during, and after events. You can be a ringside physician in the state of California or probably anywhere else. I mean, our head ringside physician for the state of California, our chief medical officer, is a dermatologist, plastic surgeon.
Really?
Yeah, and so we actually have a few dermatologists who are ringside physicians. But from my standpoint, I was trained in family medicine originally, and then I went on and retrained and subspecialized in anti-aging regenerative medicine. So I started doing alternative treatment and care programs, and I got a master's in metabolic and cellular nutrition, and I use that as part of my practice in terms of my anti-aging approach. And it kind of was good for me, and it was good for me to have that training in the environment, work with these athletes, because today martial arts is very different from what it was back then. But in terms of how I got interested, I used to have trainers who were patients of mine, and would always come and ask me, "Hey, do you want to go see some fights? You ever think about being a ringside doctor?" I'm like, "Oh, I love watching fights, but I don't know that I don't know how to get connected to that." And so I kind of kept blowing it off. And then one day, one of my trainer patients brought me some tickets to to a fight. He said, hey, listen, go to the show tonight. I'll introduce you to one of the docs. He's from Fresno, California. And he's a Ringside Doctor too. And maybe you can hit it off and see if you're interested. And I go, okay, I'll be there. So I went there and watched the show, introduced myself, and there had to be some officials from the state of California, the Athletic Commission, and I told them, yeah, I was interested, and they took down my information, and within a few days I got a phone call from the Athletic Commission saying, hey, we're looking for doctors to train in your area. Would you be interested in coming on board? And I said, absolutely. So I did my training events, and I got certified as an official ringside physician a few years later after that, and then subsequently was working events within a few months. There were some senior doctors back in those days that taught me, and I learned a lot from, and that's what I do now, because I'm a senior doc now, and I've been doing it for about 20 years, and so I train other docs and show them what to look for, how to do the job, and mostly I try to be clear about our jobs as ringside doctors. We're mostly high-level triage agents. We're trying to figure out what to do with an athlete, if they can compete or not, if they want to compete or not, or if they're capable of. And if they're not, then we need to know what to do from that standpoint. And if they are, then we may let them proceed. And so it just comes with a lot of experience over time that you learn how to manage these things. But most doctors can become a ringside physician. It's just they got to be willing and be able to give a physical exam, the type of exam that we're looking for, and be able to apply those principles into our evaluations and management of conditions in the ring.
Interesting. What are some of the most common injuries that you see?
Well, it depends if we're talking about boxing or martial arts.
Both.
So boxing you'll see facial fractures or lacerations. Those are probably the most common injuries that we will see. And as far as and in mixed martial arts, those will typically be extremity injuries. So they see elbow injuries, knee injuries, just because of the style and the different aspects that go into being a mixed martial artist in comparison to a boxer, because mixed martial artists use their feet and legs and elbows and knees, and you don't use that in boxing. You use your fists, right? So those injuries are limited to those areas. But in boxing, they also have a bigger glove, so they have a little more cushion. So occasionally you see broken hands there, but not as often, or not more than you would think that you would see. Because in mixed martial arts, we never see broken hands, hardly, now that I think about it. But I think that's just mostly because it's not all about striking all the time. It's about other stuff, trying to take your opponent down.
I had an interesting thing happen many years ago when I was training regularly, like 5, 6, 7 days a week. I had to go to a doctor for a physical. I think it was for an employment physical or something, and I had bruises all along here, and on both shins. And the doctor took one look at me and said, "We need to talk." And I thought, "What?" And she said, "Where did you get these bruises?" And I said, "Kung Fu." And she said, "What?" And I said, "Kung Fu." And I really had to do some explaining that, yes, I purposely subject myself to this. It's part of the training, and it's really okay. She kind of looked at me suspiciously and said, "Okay." But now, you've mentioned anti-aging a couple of times. Have you ever been to the anti-aging convention in Las Vegas?
Yeah, several times.
Interesting, because my friend Dr. Robert Goodman is the chairman founder of the A4M, and I've actually been. I think it's a great event.
Yeah, I know exactly who he is. I've seen him speak every time I've been there. He's legendary. So, yeah, he's made a big impact in the anti-Asian revolution, we'll call it, in this country, in the world rather. And it's been amazing, and I do enjoy looking forward to going to that event every year, ever since 2010.
He's also a martial artist, and he's a big supporter of the Martial Arts History Museum in Burbank. So I run into Dr. Goodman here, there, and he is all over the place. All over the place. It's like I can't keep up with him. You have also met another friend of mine, Benny the Jet Urquidez. Tell me about that.
So with Benny, I met him just kind of a passing thing, and when I was working a mixed martial arts event in Burbank, California, of all places. And just in passing, he just happened to be there. But when I was a kid, I remember him because he was a big star back then, back Ernie Reyes Jr. days and all those people back then. It was, Barry Gordy, all these fantastic martial artists. And so I remember who he was. It was just a passing thing, and I was kind of in awe because I saw his posters. Oh my God, that was him. Because it had been so long since I've been connected to that, between medical school and training and becoming a professional and working in the medical field world. You just get so disconnected farther and farther away, and then you start to see these people again, and it comes back to you. Oh wow, oh that's who that is. It's interesting how it triggers all those memory cells that kick back into gear. But it was very cool. It was like they were sponsoring there, and he was doing a special appearance. It was very nice to see him. He looked great. Amazing.
Benny is one of the sweetest guys I've ever met, which probably sounds strange, him being just this killer fighter, But how I met Benny, and of course I knew who he was. He was on the cover of the magazines I was buying back in the days when I started martial arts. I went to, it's an awards dinner for the Martial Arts History Museum, and I was talking to a longtime friend of mine, Carrie Wong, and Benny comes walking up, and I mean, I'm frozen. I am so in awe. And he reaches out, shakes my hand, he says, "Hi, I'm Benny Urquidez." I know who you are. But who are some of the others you may have met at some of these fights, especially down in the Southern California area? Don the Dragon Wilson?
I haven't met him in terms of martial artists. Not we'll say the classic martial artist. More of the mixed martial artists, or
Okay.
what really, because there was a long absence between my experience way back in those days and then going into what I do now. And so in the modern day things, people like fighters like Chuck Liddell, Tito Ortiz, all these great athletes, Randy Couture, George St. Pierre, all these guys. I met them because I've probably done a lot of the physicals or seen them at the shows, and they come because they have athletes that they train also. So I see them and I know them as managers now, or as peers for them, and they're in their corners helping out. So all these athletes are I think I'm accustomed to seeing them on a regular basis now.
Okay, Chuck Liddell, his entertainment representation, Zinkin Entertainment, is right here in Fresno.
That's right.
So I've bumped into him here, but I have a funny Chuck Liddell story. This is about 10 years ago, and one day I got a strange text on my phone and a little picture of Casey Olson, who was a friend of mine. He still is. But what the text said was something I know Casey would not say to me, or probably not anybody else, and I was like, there's something wrong here. So I contacted Casey and I said, "Did you mean to send that last message to me?" And he says, "Chuck has my phone and is sending stuff out. Sorry." That's, I guess, one of Chuck's things. If I find your cell phone.
Yeah.
But yeah, he's quite a character. You mentioned some other names. Have you gone to like Canada for MMA or UFC events?
So I go to Vegas for shows.
Mandalay Bay?
Yeah, and I've been there often. I haven't been there as of late because I got a son at home now, so I've kind of calmed my travel down. But in terms of, like, most of my shows are in California, so I work in California, and as a ringside physician, I'm only licensed to work in California.
Okay.
And that's okay for me because because you're in California, if you're working the show, it's different than enjoying the show. When
Yeah.
I'm working as a doctor, I'm working as a doctor. It doesn't matter, what I'm doing. So I flip the switch, and I'm not a fan anymore. I'm a physician looking out for the best interests of the athlete and trying to figure out a way to protect them or make sure they're not getting hurt, and what I'm going to do if some situation arises, or maybe I'm observing something and I'm getting concerned about it. So it's just a different mindset that you're in. When I would go to watch shows and enjoy them, I usually go to Vegas because it was closer. I can't think of any shows that I've gone to outside of Nevada or California, only because it would work. I have friends in places like UFC, and I would only work those angles if I really wanted to go see an athlete compete, and usually it'd be closer just because of obligation to family and wanted to be closer. They didn't want to be away for too long. So.
Okay. Tell us a little bit about anti-aging and how that would tie in with athletes. I mean, because different sports have basically different age limits, where like maybe a baseball player is going to last longer than a football player. And you also do stem cell therapy?
Yeah.
Okay, is that for like injuries to knees or?
It can be used for injuries, for joints. It can be for soft tissue injuries like skin, things like that as well. I usually try to focus on some cosmetic treatments as well as articular disease, whether it's knees, hips, shoulders, even smaller joints sometimes. As far as my perspective from anti-aging goes, part of that whole perspective goes back to the A4M conferences, and when I started learning more and more about anti-aging, I already had a little niche in it, and hormone, as far as hormone replacement therapy goes back, before those, I started going to a lot of those events before like 2009, but then I really became really engulfed in it afterwards, and realized that I really wanted to incorporate the nutrition, because when you're looking at the 4 pillars of health and getting your body in the prime state that you want it to be, and for keeping that for as long as you can, you need to work all the angles of that. So I always talk to people about their hormone balance. I talk to my patients about their nutrition, which is different from eating, 2 different things. And then I talk to them about a good exercise routine, and I always talk to them about getting adequate rest and recovery. And I tell them that all that's fantastic. If you got all 4, that's great. You got what you need. But if you can't control the one independent variable called stress in your life, that's going to destroy all that base that you've got set up. So the mind balance is super important into making all your 4 pillars work. So they all kind of work together. I'm really good at the hormone part. I'm good at the nutrition part. As far as training and having a good exercise routine, I like to tell people, I like to get them connected rather to at least a trainer or some type of exercise routine that they want to do, whatever that's going to be. As long as you're doing some type of exercise routine, and if they can do a little resistance training, that's even better, because you want to maintain good bone health, heart health, brain health. As far as my nutrition, I do a lot of nutrition in my office. We do a lot of analysis for deficiencies and replacement, and some of it may be based upon genetic workups and laboratory evaluations, and some of it be based upon a lot of particular needs depending on what somebody's competing in. And as far as adequate rest, I think that is got to be a priority in patients and people's life. Okay, how they get their rest is critically important. I see an enormous amount of patients in my practice that have sleep disorders, and what I mean by sleep disorders, simple things like insomnia or sleep apnea. And those things can be immensely detrimental to longevity, risk of cancer, heart disease, stress, all kinds of things. So we really need to focus on getting adequate rest. And sometimes that comes with managing people's stress, because some people look at, well, if I'm just kind of toning it down and getting enough rest, but yeah, that's not stress. But if your part of your stress management program is getting a good rest recovery program, then maybe it does. Maybe it does. And so my perspective is I try to work on stuff that I'm really good at, which is the hormones and nutrition, get them plugged in for exercise routine, refer them out or tell them to work on a meditation program, because there are some pretty cool websites out there that offer some meditation techniques. They're essentially free. You can get apps on your phone now, and I try to redirect people into those things to help them clear their minds, get some good recovery time, because as you know, we're all multitaskers these days, and we all got a little bit of ADD, otherwise you can't be successful.
This is true.
Yeah.
It's true. Now, how do you feel about women fighting at some of these MMA events?
So as a physician, I treat everybody the same. They're all athletes to me. I'm all concerned about their health, and this is their profession. I got to keep them healthy so they can continue to compete, because this is their profession. This is going to make their living. They're going to make their living this way. My job is to minimize damage, because they're going to get damaged, but you want to minimize unnecessary damage, period. And so I look at it from that perspective. As a spectator, I have 3 daughters. I don't want to see my daughters fighting. I don't want to see them beating each other up, because the conditions are different from where it was back, like say, in my day of training. Everything was like a touch kind of thing, showing your control and your perfection and your movements. Now it's full contact, hurting. And so, because I have daughters, I don't want to see my daughters, so I always get a little concerned But I also recognize this is a profession. They're choosing this for their profession. They understand the risks to competing in this profession. So I accept it. Do I worry for them? Absolutely, I worry for them. Absolutely, I worry for them. But it doesn't mean I don't worry for the male athletes also. I worry about them all the same. It's just that maybe because I have daughters, and I mean, originally, and now I have a son, and I want him to compete and to be able to handle himself. Do I want him to get struck in the face? No.
Yeah.
Because people ask me all the time, hey, Doc, how many amount of times is it safe to be struck in the head? I go,
Oh.
0.
Yeah.
0. I'm like, what do you mean? Like, it's never okay to be struck. And so when you're a fighter, you're taking that risk into your hands. You're accepting that risk. And I understand some people want to do that, and that's what they were made to do, and that's okay. I mean, I'm here to help protect them and let them compete and make a living. That's bottom line. I'm a fan of the sport. I've always been a fan of boxing and martial arts. You know, I do have an apprehension as a physician for letting unwarranted damage occur in the competition.
They used to try to talk me into going into the sparring events at the tournaments because there really didn't have very many females at John Cho's Kung Fu School back in the day when he first opened on this end of town. He always taught down at the Chinese Consolidated Benevolent Association, the School of Confucius. That's where I was going. I went all the way across town to get my Kung Fu lessons because I couldn't find an authentic Kung Fu school in town, but Kung Fu was what I wanted. But sparring wasn't really my thing, but I had to do it as part of my training. But as far as competing in tournaments, no, I liked weapons. So you mentioned your son. Of course, I've seen his pictures on Facebook. He's absolutely adorable.
Thank you. Thank you.
And he looks like he's going to be a stout little guy. So you wouldn't mind if he competed, but you'd rather...
I want him to do a sport. I do want him to do and rather learn self-defense techniques and how to defend himself. So he will learn things like judo, jiu-jitsu, because I think those type of grappling maneuvers and are really super special and important. I'm very big on that, and he will know how to box. But that's not because I want him to box. He will know how to box because I want him to learn how to protect himself. If he wants to compete in grappling tournaments, I'm okay with that because there's no striking in those, and you know, and I feel like I want to protect his brain because I have other aspirations for him. You know, I mean, if he chose to be a competitive fighter, I mean, that's his choice. But I would like him to maybe follow in the footsteps of his dad, you know, and be a physician, and heal people, help people. That's a different way of getting your fix, I think, of humanity in life. It just depends how you're wired, you know. I get my rush by doing that, and I suspect that maybe he will too.
Now you mentioned you have a twin brother. Is he also a physician?
He is a chiropractor.
Okay.
And I think he's also got his registered nursing license too. So he's a DCRN, and he's been working in the Bay Area, the East Bay Area, in a city called Danville for many years now. And he practices his medicine or his treatment of his clinical practices there.
Yeah. No, I go to a chiropractor. I've been going to David Markovich for probably over 20 years now. Met him at the gym. It seems like that's the good place to meet doctors, is at the gym.
That's right.
We met at GB3 on New Year's Day through our mutual friend Tracy Tappan. But she had told me about you already, so I had called and made an appointment. I'm so glad I found you. And I'm not just saying that, because in fact, it's kind of funny. I'm the type that would go to the doctor once a year, maybe because I had to, or the insurance company was encouraging me to, or I needed a refill on a prescription. And I remember the day that I walked out of here and I said, I'll see you in 6 months. And I've been back probably once a month since then. Because the difference between an MD and a DO is?
It's kind of a long answer to that, rather.
I can give you my answer.
Well, okay, I'm gonna tell you mine, and then you
Okay.
can tell me yours.
All
And
right.
so this goes back to when I was deciding whether I wanted to go allopathic medical school or osteopathic medical school. And at first it was under the subject osteopathic and bone doctor, but it doesn't mean that. Osteopathic just happened to be the term by which we labeled physicians back in those days, going back to the osteopathic profession when it was born. And what I felt that was I could do more for people if I was rounded in a way where I had a holistic, homeopathic, naturopathic, and a Western influenced medical practice that I can put together and treat my patient as a whole, as opposed to separating things out into a systems approach. And so, because traditionally allopathic medicine was a systematic approach to treating organ systems. Well, we know in real life now that that's really not the way humans operate. All the systems work together, integrated. And so we should approach patients in an integrated fashion, and that's why we treat people with nutrition and a good exercise routine. Okay, and if you need some medicines, we help put that in, but we use physical medicine also. And so, as an osteopath, I can provide physical medicine if I need to, and I do that for some of my patients through some of the techniques that I learned in training, which is very similar to some of the chiropractic technique treatments. Of course, for me, as a physician, I don't have as much time to treat my patients. So if it's a quick assessment treatment thing, I go, or if I have enough time, sure, we'll do it. Otherwise, I refer out to my colleagues who are chiropractors. I have some great chiropractic friends, and I trust them, and they work on me, and they've got the time to work on me. Sometimes, given in the medical practice, because our overhead is much costlier, and I have to, have more staff, it's not possible to take the time that you would normally want to take. Mm-hmm. Of course, I learned that all after the fact. The reason I just got into it originally was because I really enjoyed when I went to my post-baccalaureate program in New York, and I learned at an osteopathic medical school what the difference was. Like, oh, this is very cool. You can do this, and this for a patient too, but I can't if I do this. Yeah. So when I had the option, I said, I'm just going to apply to one medical school. And I applied to one medical school in California, and I got in, and happened to be in osteopathic medical school because that's what I wanted to do. And it was just the best decision ever, because there's rarely an opportunity that doesn't walk in my front door as a patient that I can't do something for. There's rarely. Because there's something I can do for anybody who walks in that door. If they just tell me what's going on, give it enough time, and I just let people talk, I know what's going on. I can probably help them in some regard with something.
Well, thank you so much for being on my show.
Thanks for having me. That's nice of you.
This is just great. And I hope that I can come back and we can do a little more on the medical side.
Anytime you want to. Anytime I come back, just let me know.
All right. Thank you.
Thank you.